Hey folks, hi, Dr. Megan Kearney here again. Today we're going to be doing some cupping. We're going to see about some connective tissue release, pulling apart the different layers for this patient, low back and mid back. Okay, so you may have seen traditional Chinese cupping where they use heat to create the suction under glass cups. That's a little bit out of the parameters for what we're allowed to do in healthcare in this country. So I will be using a set of hard plastic cups with a suction pump apparatus. So it looks like this. See it pulling the tissue up there, creating suction, little bubble of meat over there, over her bony prominence, pulling on all of the ligaments and the tendons, pulling apart all the different layers of fascia that connect everything. See the redness that's starting to come up, really nice blood flow. So she's starting to get there already. Now, because of the extent of pull and depending on how tight and restricted the tissue is, you can get some pretty wicked bruising from this. A patient earlier today left looking like she'd been attacked by an octopus. But that speaks to the level of tension and restriction that she had in her muscles, and also to the amount of change and relief that she's going to get out of that. She left today also feeling a lot better than she did walking in. We're just going to keep following her muscle structures all the way up her low back, into her mid back. How uncomfortable is that?
It's not. It's just pressure.
Not uncomfortable at all. Just a little pressure, she says. Nice long back. We're using lots of cups. Look how purple this one's getting. She may get a nice bruise under that. Lots of blood flow and change. Ooh, those are tight. I remember, folks, we break the spine up into parts like cervical, thoracic, lumbar, sacral, because it's easier for us to think about them, but the muscle structures are really pretty continuous all the way along there. She's having a problem and is pulled up at one end, she's going to have problems and restrictions other places. See if we can fit a couple more on there. Okay, great. And then we just want to let those soak for a while, see what happens. Okay, folks, so we're back here. We've let these cups soak for probably 10 minutes, maybe 15. So we're going to go ahead and take them off and see how we've done. So it's just a valve release. Ooh, she's really tight. Really stuck to her. You can see some of the bruising here on this SI joint, but here on her lumbar, look at that. Really nice blood flow, really good change there. So And while these bruises look really wicked, they're not actually painful like a regular bruise would be. They're a little bit tender to the touch, but nothing crazy. They look a lot worse than they are. See all her little capillaries there.